Hello and welcome. I'd like to do a further video on hospitalisations in the UK and specifically England. In my previous video, which was published about a week ago, I showed how the number of daily admissions had clearly been growing since the middle of August. The turning point was about the 21st of August. But what I want to show you in this video, how there's clear evidence that the rate of growth has been increasing since the middle of July. So I'm going to download the official data and open it in Excel and walk you through it. So as with all of my data analysis, I will always start with a 7-day rolling average centralized around the day that I'm interested in. So I'll just quickly add that to all the historical data, and before we do anything else, I'll actually, just for clarity, I'll remove all the other countries' data. So Wales, Scotland, Northern Ireland, so that's all the other countries. So I'll just remove those and remove the last three averages because they're not legitimate, not having 3 days. So now we have a 7-day average. So what we can do is we can plot all of the data just to look at it visually. So I actually want a hybrid chart for this, and I'm going to pop that into another spreadsheet, into another sheet, so that it's a bit clearer on any small screens that you might be viewing on. So here we can clearly see that the daily hospital admissions have been rising, but what's not so apparent is how the daily decrease started to slow. There was effectively braking force on that before it reached a turning point on the 21st of August and subsequently increased. So what I will do is I will add the growth rate to this. So it's a simple formula. It's the current day's admissions divided by yesterday's admissions, subtract 1, and you end up with a percentage. So if we quickly format that data so that we show it as a percentage, so percentage, 1 decimal place will do fine. So that's the actual daily growth rate, and we will also want a 7-day average as so. So as before, it's going to be the average of the 3 days prior, the 3 days afterwards. And we're just going to put that over all the historical data. So what we have, and just to recap the previous video, there's a point in time where the daily growth rate was always negative. That means the number of cases is decreasing day on day. But on the 21st of August, we reached a turning point, which is when the growth rate became positive and greater than 0. It's now hovering at around about 7, 8, 9%, very slightly day on day. So let's do a quick chart of these two things, and I'm actually just going to use the 7-day average to keep it clean. So just going to insert a graph there, and as with the other graph, I'll just pop it into a new sheet so that we can see clearly what's going on. So pop that over there. Just a bit of formatting to tidy this up. So we're going to put the data labels at the bottom so they're not obscuring the data. We're going to also format the axis labels, so it's going to be showing a percentage, whoops, not percentage, and we don't actually need any decimal places on that. So this will be the graph that we're going to work with. So I'm just going to take a quick screen print of this because I want to annotate this and walk you through my thinking. So I'm going to open up Microsoft Paint and just paste it into that window. So what do we have here? Well, clearly in about March or April time, the daily growth rate for hospital admissions was decreasing. So that's a consequence of us taking voluntary action, for example, not meeting up with friends and family, maybe working from home. We then had Boris's advice, which was please avoid unnecessary contact, work from home where possible. And then we also had the final lockdown, which was don't go to work, don't meet people unless absolutely necessary. So there was a point in time, and I'm just going to start highlighting bits of the graph here. So for the first few months, although it fluctuates slightly and it undulates, there's a definite kind of flatness and consistency to the daily growth rate. It was on average, if we were to look at these axes here, it's about -2% to -4%. So let's say on average it's about -3% per day. So that meant the daily hospitalisations were reducing. Now, if we look at this point in time over here, where it's clearly been growing very rapidly, So this is through from the middle of August to where we are now in the middle of September. It's clearly been growing very rapidly, and there's an intermediate area here as well, where clearly there's been a rise of some description. So if I just highlight some of these, so I'm just going to use a thicker pen. So roughly speaking, we've had a steady -3% day on day. We've clearly got something which has been rising over time, and this is just approximate. I could do it mathematically, but that would take more time than I want to put into this video. And then this point in time also, there has been some kind of steady increase. So what can we say about this? Well, there's some interesting points to highlight here, and I'll pick a new colour. So on the 4th of July, I'm going to want a thicker brush. On the 4th of July, which was here, was when we had some major changes to our restrictions, and we could start to go out to pubs, restaurants, people encouraged to go back to work. People could meet up with friends and family in their gardens, albeit if the weather turned bad, being the UK, then maybe they went indoors for a little while. So this was a significant point in time. Now, it's worth noting that when you look at hospitalisations, this is an indicator of people who became infected about a fortnight beforehand. And if we said that we would expect some kind of change after 4th of July, then you're then talking about any potential rise in hospitalisations would be around about the 18th of July onwards. So I'm just going to annotate that and put a vertical line here to say, if hypothetically speaking there was any change as a consequence of easing restrictions on 4th of July, that would start happening from approximately the 18th of July, give or take a few days. So what have we got here? Well, we've got this modest increase, we've got this which is starting to accelerate, and we've now got where we are today, which is seeing an increase of about 8 or 9% per day. That leads to a doubling time of about 8 to 10 days, depending on which day you're looking at. So, what do I want to show you about this? Well, let's start highlighting some weeks here. So, clearly at this point in time, 30th of August, there was another step up in terms of the seriousness of the growth rate. So if we work back a week from there, we end up at the 23rd. If we work back another week, we end up at the 16th. If we work back another week, we'll end up at the 9th, which is here. And if we work back one more week from that, we'll end up at the 2nd, which is here. I may as well put the one more week in the middle, which is approximately here. So we've got week on week, there's been a rise in the growth rate. And as I say, this is a window on what was happening 2 weeks prior in terms of the number of infections. So it was at about this point in time, which was the 30th of August, that I noticed that the hospitalisations were increasing. Not only the number of daily admissions, but also the growth rate itself was accelerating. So that was a window on what was happening around about the middle of August. But we can clearly see also at this point in time, which was the 16th of August, the admissions were starting to really take off. So if you work back 2 weeks from that, you can say that's late July. So to a lesser degree, we can also look at what was happening in July itself. So I think it's safe to say that at this point in time, we were seeing an increase. You can see that visually. I could do it mathematically, but that would take too long in the video. And that being the 31st of July takes you back to the 14th of July, and arguably that trend also starts at about this point in time, which is the 18th of July, exactly 2 weeks after lockdown restrictions were eased. So people have questioned whether the numbers of hospitalisations rising is to do with the schools opening. So I'm going to just put some more annotations on this graph. So schools opened on first week of September, so I'll just tick the 1st of September, and going by the same logic that you expect any following hospitalisations to be a fortnight later, then you would expect them to start showing themselves around about the 15th, but anything prior to the 15th would not be to do with the schools. So we've got this point here and onwards, which is going to be the result of schools going back. So to quickly answer a question, are these changes we're seeing, and we're seeing in the news, the number of daily hospital admissions is increasing. Is that to do with schools reopening? The short answer is no, not yet. But clearly there is a balance to be struck between getting the kids back to school. Clearly that's important for their mental health and it's important for their future opportunities, and balancing the rise of the spread of the disease. So I'm not going to discuss any politics in my videos. I'm not going to criticise any policies. I do understand the need to keep businesses alive during this time because people will need employment at the end of this all. But the clear point at this time is we're seeing an ever-increasing rise in the growth rate for daily hospital admissions. It's currently averaging about 9 or 10%, and that means the number of hospitalisations doubles every 8 to 10 days. If left unchecked, then you'll may have seen the press release or the explanation by Patrick Vallance and Chris Whitty today, and that will explain where we could end up in terms of the end of October. So clearly things have to change, and we need to get our behaviour back to similar to where it was in early July. So the long and short of it is we're going to have to stop mixing with friends and family unless where it's absolutely essential, perhaps working from home more again where it is possible to do so, and hopefully that will get the virus back under control again. If it doesn't, then I see no option for the government but to start forcing rules upon us, which nobody wants. We can potentially avoid it through voluntary actions and following the advice, and basically it's your call. Are you going to do it voluntarily, or are you going to wait for the government to force some rules on us and complain about it later? Hope you enjoyed the video. If you did, please like. If you're interested in the topics I cover, please subscribe to the channel. I have more ideas of what to cover over coming days and weeks. That's all from me. Bye for now.